Hello, I'm Dr. Sagar, consultant pulmonologist. I'm working in both Mazumdar Shah Medical Center at Narayana Health City, and also I'm a visiting consultant in pulmonology in HSR Narayana Multi Specialty Hospital, HSR layout. So we all know, we celebrate World No Tobacco Day on 31st of May every year. So this year's themes on World No Tobacco Day is we need food, no tobacco. So now coming to the quantity of problem, especially in India, around 25% of the population has taken up smoking in any form. So around 25 crore people in India, that amounts to around 20% of the population consumes tobacco either in oral or smoking form. So what are the types of tobacco products that people generally use? That is smoking in the form of cigarettes, BDs, and in the form of Kani, that is oral tobacco with chalk powder, and they tell Gutka. So that is areca nut powder, areca nut with tobacco. So the higher socio-economic status population usually uses cigarettes and all. The lower socio-economic strata relies more cheaper products like Kani and Gutka or BDs. So how do people take up smoking? What makes them to take up smoking? Usually the people take up smoking at a very young age in the form of pleasure. So after using it for some time, they become regular users. Like when they meet friends and all, it becomes a natural behavior that they all, as we have tea and all, when we meet with friends, they'll take up smoking. So after that they become addicts, without taking up this smoking or oral tobacco products, they feel some adverse effects like irritability, sweating, anxiety, palpitations and all. So that develops into craving. So this craving makes them to take up tobacco again and again. Now coming to the quitting of smoking, every tobacco user at some point of time he becomes fed up of the problem because he craves for that product again and again. So he wants to quit. So around 50% of the people who use tobacco products want to quit at some point of time. So among them, 50% of the people try to quit, and the successful people will be only 3% among them. The people who want to quit, the most important thing is their dedication towards quitting or commitment towards quitting. So multiple relapses might happen, but if the people are mentally strong and the commitment is good, they can quit the habit with multiple attempts. Few pharmacological agents also which help in quitting, they are nicotine gums. They are available in 2 mg and 4 mg. So 2 mg nicotine gums are used in people who take less than 10 cigarettes per day, and whoever take more than 10 cigarettes per day, they can use 4 mg gums. So there is a particular technique with which they have to use this chewing gum. It is not like any normal chewing gum, they'll just take it and chew it, because the taste is not that great and it induces lot of gastrointestinal adverse effects like retching and hiccups. So the specific technique used in this nicotine chewing gum is, the person after taking up that nicotine chewing gum, he should chew for around 10-15 times. After that, he has to pack that chewing gum between the teeth and the buccal mucosa. So once the tingling he gets, he should park it between buccal mucosa and the teeth. This is called as chew and park technique. So when he parks it, he gets some amount of kick, what we say in smokers language, they'll get that quick kick, and once the kick wanes off, again he'll chew and park it between the buccal mucosa and the teeth. So this 3 or 4 cycles he can make. So after that he can spit out the chewing gum. So other pharmacological agent what we can use is the nicotine patches. They are available in 21 mg, 14 mg and 7 mg. So the person who smokes more than 20 cigarettes per day, he can start with 21 mg patch. The person who smokes around 10 to 20, he can use 14 mg to start with, and the people who smoke less than 10 cigarettes per day, they can use around 7 mg patch. So the person who starts with 21 mg, he should be slowly tapered over 15 days to 1 month period from 14 mg to 7 mg. So other non-nicotine products are bupropion, which is an antidepressant, should be taken by people who are committing to quit with consultation with the psychiatrist. So the other pharmacological agent is called as varenicline. It is available in 0.5 mg and 1 mg. So this also will be prescribed by psychiatrist only. So in India, this product is very famous in the name of Chantix. So what if the people doesn't quit? What will happen if they continue to smoke? So the smoking is associated with number of health effects, health hazards like the smoking induced bronchitis. People might get something called chronic obstructive pulmonary disease, and in asthmatics they get severe exacerbations. And the most important thing is the smoking is associated with lung cancers and other forms of cancers also. So on this occasion of World No Tobacco Day, I urge all the viewers to think seriously and take the first step towards quitting. Thank you.